House Republicans are pushing to slash nearly $1 trillion from two of the nation's bedrock safety net programs, Medicaid and food stamps, as part of their sweeping package aimed at enacting President Donald Trump's agenda. If the legislation is approved, millions of Americans could lose access to these benefits as a result of a historic pullback in federal support. Trump has repeatedly vowed not to touch Medicaid, while GOP lawmakers insist that their proposals would largely affect adults who could, and should, in their view, be employed. But the actual impact would likely hit a far broader range of Americans, including some of the most vulnerable people the GOP has promised repeatedly to protect, experts say. They include children, people with disabilities, and senior citizens. A sizable share of the U.S. population depends on these programs. More than 71 million people are enrolled in Medicaid, and roughly 42 million Americans receive food stamps, according to the federal agencies that oversee them. Hospitals would also feel the financial fallout of the Medicaid cutbacks, which could prompt some to raise their rates for those with job-based insurance and others to close their doors. States would have to shoulder more of the costs of operating these programs, which could force them to make some tough decisions. Among their options could be slashing enrollment, benefits, and provider rates in Medicaid or pulling back on residents' access to food stamps. They might also shift spending from other state-supported programs such as education and infrastructure or hike taxes. In addition, grocery store owners are warning that cuts to the Supplemental Nutrition Assistance Program, or SNAP, as food stamps are formally known, could harm local economies and cost jobs. We've never in history experienced coverage cuts of this size, and that makes it really difficult to predict how states, providers, and patients will respond, said Alice Burns, an associate director of program on Medicaid and the uninsured at KFF, a nonpartisan health policy think tank. For the past 50 years, there have been these incremental increases in the availability and access to health care and health insurance coverage. So moving backwards and taking coverage away. This isn't something we've seen before. What proposals actually make it to the House floor for a vote remain to be seen, since conservative and moderate factions of the caucus are currently battling to make changes to the provisions, and more alterations are expected in the Senate before a final bill is enacted into law. The House GOP package would reduce federal support for Medicaid by nearly $700 billion over a decade, according to an updated Congressional Budget Office analysis released on Tuesday.